Welcome back to my channel. Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the signs of imminent labor. Let's get started. Imminent labor is the stage just before true labor actually starts, when the body shows clear physical and emotional changes indicating that labor will begin very soon, within a few hours or days. During this period, the mother may notice various signs as the body prepares itself for childbirth. In this video, we are going to see these changes in detail and understand how to identify imminent labor clearly and confidently. Now let's talk about the first sign of imminent labor, which is lightening, also called engagement. This happens when the baby's head descends down into the pelvis, and it is more commonly seen in first-time mothers. Because the baby moves lower, the pressure on the diaphragm reduces, so the mother often feels that breathing becomes easier. At the same time, there is increased pressure in the pelvic area, which can cause a feeling of heaviness and more frequent urination. All these changes are normal and clearly indicate that labor is approaching, and the body is getting ready for childbirth. Now the next important sign of imminent labor is increased vaginal discharge, which we commonly call the bloody show. This discharge is usually thick and sticky mucus mixed with a small amount of blood, and it happens because the cervical mucus plug starts coming out. As labor approaches, the cervix begins to soften, thin out, and slowly open. And during this process, the mucus plug is expelled. Seeing a bloody show is actually a normal and reassuring sign because it tells us that cervical changes have started and labor is likely to begin soon. That's why we consider it one of the most reliable signs of imminent labor. Now, the third important sign of imminent labor is regular uterine contractions. These contractions gradually become regular, stronger, last longer, and occur more frequently with time. The pain usually starts in the lower back and then moves forward to the abdomen, which is a typical pattern seen in true labor. Unlike false labor pains, these contractions do not reduce with rest or by changing position. Because of these features, regular uterine contractions help us clearly distinguish true labor from false labor and indicate that labor is actually beginning. Now the fourth sign of imminent labor is rupture of membranes, which is commonly described as the breaking of the bag of waters. The mother may experience this as a sudden gush of fluid, or sometimes as a continuous trickle of clear fluid from the vagina. This can happen either before labor starts or during labor itself. Once the membranes rupture, there is a risk of infection if labor does not begin soon, so it is important for the mother to report this immediately and seek medical care without delay. Now the fifth sign of imminent labor is cervical changes. As the body prepares for childbirth, the cervix gradually becomes soft, starts spinning out, which we call effacement, and slowly begins to open or dilate. These changes are usually identified during a vaginal examination by a healthcare professional. When we observe these cervical changes, it clearly confirms that the body is progressing towards labor, and that true labor is approaching. Now, moving on to the sixth sign, which is low backache and pelvic pressure. This happens mainly because the baby's head starts pressing on the pelvic nerves, so the mother may feel a constant heaviness or pressure in the pelvis, along with a dull, aching pain in the lower back. This pain is usually persistent and may come in a rhythmic pattern, unlike simple back pain that goes away with rest. Along with this, the seventh sign we often notice is increased energy, also called the nesting instinct. Here, the mother may suddenly feel very energetic and have a strong urge to clean, organize, or get things ready for the baby, even after feeling tired for days. This burst of energy is usually short-lived and is often followed by fatigue, and it is another indication that labor is approaching soon. So that brings us to the end of today's session. If you found this explanation useful, don't forget to like, share, and subscribe. And feel free to leave your comments or questions below. Thank you so much for watching, and we'll meet again in the next class with another important topic.